Good afternoon. Thank you all for joining us today for our COVID-19 update. At the outset of the vaccination effort in San Diego County, we set a goal to move with speed. We set a goal to, as quickly as possible, administer as many vaccines as we could. Rapidly and quickly administering vaccines helps us as we come out of the pandemic. When you have a raging wildfire and you can remove fuel from that fire, you can help significantly lower the danger and lower the ongoing difficulties and challenges that we'll face. And so we set a goal to move as fast as possible. And I believe in many ways we have done that, and we have done relatively well. If you go to the state of California's website and you look at the total dosages administered based on population, out of the largest counties in California, we are right at the very top, just barely behind Contra Costa County and the number of dosages that have been administered based on population for the largest counties in California. And that is a testament to a lot of incredible hard work, incredible partnership with many of our health systems, county workers that have moved heaven and earth to stand these sites up rapidly, and the public that has been patient as we understood that speed was our goal in terms of getting vaccines administered. We also now have 19 total sites across San Diego County that we are running, administering, working in partnership with others. Those sites now have the capacity and potential to do 20,000 vaccinations, more than 20,000 vaccinations a day, every single day. The problem that we have now is our efforts have far outpaced the supply of vaccines. With moving forward what we have in inventory and what we are looking at and what we're doing in the days ahead, we will only be administering about 10,000 per day at these locations. Again, 1/2 of the capacity of what we could do because we have just gone beyond the supply of vaccines. I don't think the supply of vaccines is anyone's fault. The feds can only allocate to the states what they have. States can only allocate to counties what they have. And as a county, we can only give what we have received. But the supply of vaccines has not kept up with our ability to build out infrastructure to administer them. And we hope that that changes in the near future. The good news for San Diego County is, in addition to being at the very top in our state of dosages administered, we have the infrastructure in place. So if those supplies increase, we are poised and ready and can quickly ramp up. Right now, we can do more than 20,000 a day. We think in a week or so, as we continue to plan out infrastructure, we'll be able to administer more than 30,000 per day. But again, the limiting factor here is the supply and the availability of vaccines, and we continue to hope that that changes. In a minute, I will walk you through a map of where our sites are right now. Our 19 sites, again, are 8 county pods, 4 partner pods. We now have 4 super stations up and running, and then 5 programs we're doing with county fire in rural or harder to reach efforts. And those, we think, all give us an opportunity to go. We will be meeting all of the scheduled appointments, but again, the appointments, we're only going to make appointments available for vaccines that we know we have or we are confident are coming. And so the great frustration the public has is, why can't we get more vaccines? We keep going to the website, there's no appointments, there's nothing there. We don't want to cancel an appointment. And so we're only going to release and make appointments available as we have a high degree of confidence that we can fulfill them. Over the course of the last few days, I've had direct conversations with Governor Gavin Newsom, with Secretary Galley, with Yolanda Richardson, with the CEO of Blue Shield, doing everything we can to ensure that they understand our situation, and I think that they're doing everything they can to support us. We did draw down an extra 5,000 vaccines in addition to what was being sent to help get us through, and that is helpful. And I really want to commend our county staff who are going through every vaccine shipment that has gone out to a location, calling those folks, what is your plan to administer them? How can you ramp up that plan to administer them? If you don't have a solid plan, can we take them back? Because we have the ability to do it. Dr. Wooten has been leading that effort and working with all of our healthcare system providers who are getting vaccines. And so we want to continue to see us move forward, and we want to continue to be as efficient as possible. But there is some encouraging news in terms of what we've done in the county and the position we're in. And again, we will make it work better and make it more convenient and make it more seamless. But the original goal and mission was to get as many shots in arms as quickly as possible. We will continue to do that. I also will share you an update in a minute about our long-term care facilities and skilled nursing facilities. There are about 1,300 of those in San Diego County, and these are being reached via a mix of CAL FIRE Operation Collaboration, a joint effort of multiple fire agencies, some work that the City of San Diego Fire Department is in the process of standing up, and work that pharmacies are getting moving. Out of the just over 1,300, 911 of these facilities to date have had their first dosages begin to be administered. And so we are making good progress in getting through these long-term care facilities, and the rest of them are scheduled to receive their first dosages. And so we think that is an important part. Another issue that's come up recently, and we've worked hard as a board to make clear as a county that we will respond via the issue of health equity, is some concerns about the who is receiving the vaccines. And I think it's important to note that right now we've done healthcare workers and we're doing seniors 65 and older. That demographic looks much different than the demographic of the county as a whole. And so what you see on the dashboards around the demographic breakdown in large part does reflect the demographics of healthcare workers and seniors in our county. But we want to do more, and we're going to be launching a number of very targeted programs to ensure those communities that have been hardest hit are able to receive the vaccine. And Supervisor Vargas will walk you through some of those efforts and programs that we are putting in place now that will help. And we also continue to increase staffing to support 211 in their efforts, so seniors who do not have access to a computer will be able to call and talk to a person. Again, the limiting factor is the availability of appointments, but we are making significant increases in the number of people who are there and able to take and answer a call. So with that, let's jump into our charts here. I'm going to walk you through a few of these, and then we'll hear from Supervisor Vargas, and Drs. McDonald and Wooten are here for Q&A. What you see here on the COVID dashboard is the total dosages shipped to our region, and then the total dosages that have been administered. You see first shot and second shot. And again, we know 357 is what we're reporting on our total dosages. We know the state database has us over 380,000. We know that the number is north of the 357, but we're working to increase the speed at which those numbers reflect. The delta that you see between total dosages administered and total shipped, some of that reports things that have been shipped, perhaps not received, or things that are being held back for scheduled appointments that are coming in the coming days. But we expect that total dosages number to increase. We know that it is significantly higher than what's represented there. But again, a considerable step forward. 10% of our population 16 and older have received at least their first dosage, and 2% of our population 16 and older are fully vaccinated. And again, as the supply increases, we will be able to increase those. Let's go to our next chart. What you see right here on the map is just the location of the current county and partner pods which are in place. You will notice that most all of them now we have opened up a considerable number. We have 2 of them that are future ones that are coming. One that is developing in Escondido, and then one that's coming in the North Coastal area. And those are ones that should be coming on within the next week. And then what we'll really be doing is just standing poised and ready to increase the throughput at each of these sites. Again, we have about double the capacity to administer vaccines that we actually have vaccines in place. Next slide. This is just the long-term care facilities. Again, you see just over 1,300. 911 of those facilities have received at least their first dosage, either through our partnership with our fire departments or through the partnership with the pharmacies. And we know that hundreds more are scheduled, and we think that we will be able to get through all of those in the coming days. Next, we'll go to our cases. Again, a second consecutive day below 1,000, and this is encouraging. You got to go back to the end of November where we had a single day under 1,000, and so we are encouraged by this trend. But again, we want to remind the public We have new, more contagious strains that are out there, and this is not a time where we can lose our focus. We need these numbers to continue to come down. We want to descend into the red tier. We want to get more things open, more opportunities for our community, make it easier for our schools to open, for our kids to get back playing sports and our small businesses. So this should motivate us to really double down on what we are doing and continue those efforts so that we can continue this downward trajectory. But the combination of being on the leading edge of number of vaccines administered and the decline in cases should give us a sense of hope that things right now are headed in the right direction, but a hope that motivates us to do more, not less. Next chart. Again, hospitalization numbers, these are going to lag the decline in cases. We know that there is a lag until we see that, but generally speaking, trending down ever so slightly day over day. And I know this is welcome news to our hospital systems to have those COVID numbers continue to trend down very, very slightly, but again, trending in the right direction. The ICU capacity, you see, the box right there is staffed and immediately available, and people say, why is this not moving given the cases are coming down? And again, as the COVID ICUs took up a greater share of available ICUs, non-COVID ICU had procedures delayed or rescheduled, and so now our healthcare systems are going to be for a while trying to catch up a backlog of a lot of those things that we're able to delay, and so we don't think we'll see much considerable change in this number, even though we are headed in a better direction overall with cases and generally with COVID-related hospitalizations. And then, unfortunately, we report today 54 additional fatalities ascribed to COVID-19, brings our total to 2,683. And our final chart here just shows where we are in the tiered system. Again, you see that both the unadjusted case rate and the adjusted case rate are both trending down. You can see our unadjusted case rate from just a few weeks ago in the middle of January was at almost 90, then it was over 90. We've now cut it down to 50. The adjusted case rate, again, takes into account the testing, and we continue to do more than average number of testing, so we get some credit on the adjustment coming down. Our percentage of positive also coming down, and our health equity testing percentage positive coming down. But you also see that we've got a ways to go to get down to that next tier in red, which is why we continue to stress with the public that we really have to be mindful and follow all of the advice that's out there. So bottom line, good news on vaccines in terms of our ability to get shots in arms. Good news on the direction of our cases, but that should motivate us to remain vigilant and continue the positive direction of motion. And again, on vaccines, the limiting factor is just the supply and availability of vaccines, and we hope that increases very soon, and when it does increase, we are well positioned to be able to immediately ramp up the distribution of those. With that, I'm going to turn it over to Supervisor Nora Vargas for her update and including a walkthrough of some of the equity programs we're putting in place to help there, and then we'll get to your questions.
Good afternoon. Thank you, Chair Fletcher. We are working on ensuring there is enough vaccine supply in our sites as we continue advocating the state and federal governments for this. At the same time, we're going to continue to strengthen our infrastructure from improving our appointment system, expanding our 211 capacity, exploring ways of keeping communities informed about vaccination appointments, as well as the importance of getting vaccinated when it's your turn. We still have a long way to go to get our 65 and older population vaccinated. It is important that they do because this age group has been one of the most vulnerable and impacted by this virus. The county is going to continue to do its work with a health equity lens because we know the challenges specifically our communities have around the digital divide, language barriers, access to transportation for so many of them. With this in mind, I'm proud to inform you that a pilot program is in place to kick off this week where community health workers will start conducting outreach to our most vulnerable communities and our most vulnerable populations with the goal of providing access to appointments. We definitely appreciate the feedback from the public letting us know about the challenges, and we are listening. I do want to take this time to thank the numerous organizations that are working with us to ensure that we are doing this work with an equity lens. The Chicano Federation, Mental Health America, North County Health Project, the United Women of East Africa, Somali Family, the Latino Health Coalition, UPAC, and so many other organizations that are partnering with our communities as well. We know that the vaccine numbers in our communities of color remain low, but I want to highlight that these numbers are reflective of the different vaccination tiers and at the same time include our healthcare workers and seniors. On a side note, we know we need to make sure we have more representation of communities of color as health workers, doctors, and nurses, and so we will continue to fight for that. But in the meantime, we want to emphasize that the numbers reflect the different phases that we're in. We are committed to ensuring we have a strong infrastructure for when more tiers open up, and our county staff will continue to improve systems to eliminate any barriers that may be preventing people from accessing appointments. We have been committed to ensuring that we have pods in our neighborhoods, including the South Bay and North County, where we have populations that are concerned. Again, thank you to our community partners for your support and for everything that you do. It's been a couple of difficult months for all of us, and we thank you for stepping up. Today, we ask our community members, our trusted nonprofit organizations, and community partners and media to help us in these efforts. We know our current systems are not easy for our elderly community members to navigate, and if you're able to, we ask that you help make an appointment for them, and I know that many of you have because I'm getting a lot of texts and messages about this. Again, our county staff is doing everything they can do to ensure our systems are more user-friendly, but it's really going to take all of us working together to get as many people vaccinated as soon as we have our vaccines. If you have already gotten a vaccine, please continue to stay vigilant, wear your mask, practice physical distancing, avoid gathering with people outside of your household, and let's take care of each other so we can get back to our routines. Como escucharon al Supervisor Fletcher, estamos trabajando para garantizar que haya suficientes vacunas en nuestra región y continuaremos abogando por esto ante el gobierno estatal y federal. Al mismo tiempo, vamos a continuar mejorando nuestra infraestructura. Debemos modificar el sistema donde hacen las personas sus citas, hasta ampliar la capacidad del número 211. También estamos explorando formas de mantener informadas a las comunidades sobre las citas de vacunación, así como también comunicar la importancia de vacunarse cuando sea su turno. Todavía nos falta mucho para poder vacunar a nuestra población mayor de 65 años. Y quiero realmente enfatizar lo importante que es vacunarse, especialmente a este grupo de 65 años o más, ya que ha sido uno de los grupos más vulnerables y afectados por este virus. El condado continuará haciendo su trabajo con un lente de equidad en la salud porque sabemos que hay retos para las personas de la tercera edad como barreras de idioma, uso de computadora y acceso a transporte. Con eso en mente, me enorgullece mucho informarles que un programa piloto comenzará esta semana, conocido como Promotoras del Condado. Ellas van a comenzar a comunicarse y ellos directamente con personas de la tercera edad para apoyarlos en hacer sus citas para la vacuna. Sabemos que el porcentaje de vacunas ahorita en la comunidad de color son bajos, pero quiero enfatizar que estos números reflejan las personas elegibles dentro de la fase 1A y 1B, incluyendo a nuestros trabajadores de salud. Definitivamente tenemos mucho trabajo que hacer para que existan más doctores y enfermeros en las comunidades de color, pero por eso es que están viendo los números que ven. Pero nuestro personal está comprometido a mejorar los sistemas para eliminar cualquier barrera que impida que las personas ascendan a las citas cuando sea su turno. Entiendo que muchos de los miembros de nuestra comunidad indocumentada viven con miedo y desconfianza. Y con justa razón, acabamos de tener 4 años de un presidente que se la pasó atacando a nuestra comunidad. Es importante que la comunidad sepa que estos servicios de la vacuna son para ellos, sin importar su estatus migratorio. Sé que hay personas que tienen dudas ya que han escuchado que a la hora de hacer su cita piden seguro médico. Si usted no tiene seguro médico, no hay problema. Nomás hay que indicar que la forma que no tiene. Si no tiene seguro social, lo único que tiene que hacer es, o si no tiene un número de ITIN, lo único que tiene que hacer es poner puros ceros en la aplicación. Pero ahorita, si usted es mayor de 65 años, visite el sitio de vaccinationssupersstationsd.com para hacer su cita y a la hora de ir a su cita solo necesita llevar una identificación que compruebe su edad. Esto puede ser una matrícula consular con su identificación. Si usted tiene 75 años o más, puede llamar al 211 para que lo asistan a hacer su cita. Le quiero agradecer a las organizaciones humanitarias por el trabajo que hacen todos los días. Sé que estos tiempos son difíciles y muchísimas gracias por todo su trabajo. Hoy les pedimos a todos ustedes, los miembros de nuestra comunidad, a nuestras organizaciones comunitarias y a los medios de comunicación para que nos ayuden en estos esfuerzos. Sabemos que nuestros sistemas actuales no son fáciles de navegar para las personas de la tercera edad y si ustedes pueden, ayúdenos a programar citas para ellos. Nuestro personal del condado está haciendo todo lo posible para asegurar que nuestros sistemas sean más fáciles de usar. Pero realmente ese trabajo tiene que ser un esfuerzo de colaboración. Vamos a tener que trabajar juntos para poder vacunar a la mayor cantidad de personas posible. A las personas que ya se han vacunado, hay que continuar con su cubreboca, practicar el distanciamiento físico y evitar reunirse con personas fuera de su hogar. Yo sé que este fin de semana es el supertazón. Quiero enfatizar que es muy importante que se queden solamente con sus familias, que no hagamos fiestas, porque es muy importante que todas las personas sigan usando todos los métodos, los métodos que hemos recomendado para que no se siga pegando el COVID a las personas. Así que muchísimas gracias.
Thank you. With that, we will go to our call-in questions, and Drs. McDonald and Dr. Wooten are both here as well.
Tommy Sablon at KUSI, please state your question.
Mr. Chairman, how are you? You've stated on several occasions that in order to get the San Diego economy to reopen, it would first require the opening of schools. Now that the CDC has announced that schools can safely open, and with the county having discretion over the vaccine distribution, what are the steps being taken to prioritize teachers to be vaccinated and to open schools?
Yeah, look, I want to get all of our kids back in school. I think every parent out there does, and I think that's a high priority, and I know there's considerable effort being made at the state to try and make resources available. We've worked closely with schools to set up independent testing and provide funding and a lot of other types of efforts. So teachers will be in that first tier of essential workers, and the minute that we have any slack in our system presently doing seniors 65 and older, then we will stand ready and willing to rapidly open up the appointment system for teachers, for law enforcement, and for food and agriculture. We don't know what the supply of vaccines will be. We also don't know what the demand on appointments will be, and so we can't predict when that will happen. But we started with healthcare workers. When we had slack in the system, we opened up to 75 and older. When we had slack in the system, we opened up to 65 and older. And once we have slack in the system, we will open up to that first tier of essential workers, which includes teachers. So hopefully soon.
All right, my follow-up question, Mr. Chairman. 11 years ago, Nathan, I admired you, authoring Chelsea's Law. I watched you. I watched you walk the steps of the Capitol. I saw you at Balboa Park with the governor signing Chelsea's Law with Brent and Kelly. And I admired you, and you worked with law enforcement. And, respectfully, I'm confused at how your stance on law enforcement and why they're not in the category as firefighters and healthcare workers. It respectfully, it confuses me, and I'm just hoping you can help me understand why law enforcement isn't right there with firefighters and health workers.
Yeah, so last year we outlined the tiering of what we would do. We would start with healthcare workers. That was the highest priority. If you have a ICU nurse who tests positive, you not only lose that ICU nurse, but you lose everyone they've been in close contact with who have to quarantine. You could wipe out an entire shift of nurses with one positive case. So you start with healthcare workers. A part of that healthcare workers is people who can administer vaccines. And so having the ability as firefighters who are trained as paramedics and EMTs can be vaccinators. And so the reason firefighters were vaccinated early was so they could serve as vaccinators. They've increased significantly our workforce to be able to administer vaccines. We would not be able to run all of the sites and all of the programs we have open if we did not have a focus on ensuring healthcare workers could become vaccinators, and they needed to get the vaccine to become a vaccinator. After that, then we went to seniors. Our seniors represent 90% of our deaths, the majority of our hospitalizations. And so for a senior, COVID-19 can be a death sentence. And so right now, we are doing seniors. Immediately after that, then we go to the first tier of essential workers, which is law enforcement, and teachers are included in that. And that has been the system since we shared last year. That is still the system today. We do not believe it would make sense to take a senior out of line and replace that senior with a young and healthy worker. And so it's been the same since we outlined it last year. It hasn't changed. It's always been the same. We would do healthcare workers. We added in people that could do vaccinations because we can't give vaccinations without vaccinators. Then we're doing seniors because they are most likely to die. And then hopefully very soon we'll get in that first tier of essential workers, which includes law enforcement. It isn't about, we respect law enforcement, we respect teachers, we work with them all every single day. It's about working through the system in the way it was outlined. And I continue to not believe it would be the right thing to do to take a vulnerable senior citizen out of line and bump them from the line in order to insert a young and healthy worker.
RDO Heda at NBC7, please state your question.
Thank you. I think you pretty much touched on some of the issues that I wanted to ask from the last question. But again, just to reaffirm, you don't really have yet a timeline on when teachers, law enforcement, the Tier 1B group will in fact be up next? No guesstimate, no timeline?
No, Artie, and the reason is I don't have a timeline of how many vaccines we're going to get. If we knew with greater certainty what was coming, then we'd be able to better calculate some of those predictions. But right now, it just wouldn't be responsible to speculate on something. We've really tried from the beginning of COVID to be really candid about what we know and what we don't know. And when we don't know, tell people why. And so the supply of vaccines and the future supplies remains a mystery. We hope that it gets stabilized. We hope we get on a regular system. At that point, we may be able to better predict out. But the minute that our appointments are not being filled by seniors 65 and older, we don't want to miss any available appointments. And so the minute they aren't being filled, then we will open up to that next tier of workers. But we don't know when that will be.
Got it. And as a quick follow-up, Supervisor Fletcher, obviously you're only as good as the supply that you receive. I'm wondering if you've gotten any more clarity on how the process of obtaining vaccination doses works once the state is ready to allocate them. How is it decided how many doses San Diego County will actually receive?
Yeah, I don't know. I think you would have to work with them, and I know they're in the process of setting up some new systems. I had a very productive call with the CEO of Blue Shield, where I walked through and outlined how we're doing it in San Diego County, what we're doing it. He said, as a county, he thinks we are vastly ahead of most every other county, and that their system will align and support what we're trying to do. And so I think they're still working through that. We know we make requests for a lot. We know we get a little, and then as quickly as we can, we get that into people's arms. And we know we've built out significantly more capacity to do more vaccines, and we are hopeful that the supply will rapidly catch up. And as the supply increases, Artie, then we'll increase our capacity, and we'll just keep moving. But right now we're not entirely sure. At the end of the day, we know what we get, and we know our process to try and get it in arms quickly.
Lori Weisberg at the San Diego Union Tribune, please state your question.
This is kind of a three-part question, and it's related to the Super Bowl Sunday this weekend. Secretary Galley this week expressed concern about the potential for Super Bowl becoming a super spreader event, not unlike what we saw during the holidays. Number one, how concerned is San Diego County about the Super Bowl leading to more infections, either through private gatherings in households or through restaurants and bars this weekend? Second, will there be stepped up enforcement for those bars and restaurants that choose to air the game outside with televisions? Will there be more of that enforcement? And third, LA County decided to ban TVs outside, period. And they were especially concerned about Super Bowl, the idea of maybe when you yell and shout, you could be spreading droplets in the air. Did San Diego County at all consider that and reject it? So those are my three questions.
Yeah, thank you. And I'll let Dr. Wooten, if she wants to address what LA County did. Look, we're heading into the Super Bowl. We saw the number that Thanksgiving did to us as a region. People gathered for extended periods of time when cases were increasing, and it put a real hurt on us as a region. It was difficult to recover from. We don't want to repeat that same situation with another date that is known for its gatherings. And so we're rooting for San Diegans who are going to responsibly watch the Super Bowl. Watch it with your household members. And we're rooting for San Diegans who will be rooting for Tom Brady, who is indisputably the GOAT. But outside of that, we just need people to be safe. We're headed in the right direction. We're going in the right direction. Let's not take a step back. Just this year and this game, watch it at home, watch it with the people you live with, and just know that by next year we'll be back to a position where we're able to do more. I think that there will be some efforts. I'll reach out and talk to the mayor. We'll talk to alcohol beverage controller about some things they may do around that day on stepped up enforcement. And, to my knowledge, LA County may have taken that step. I don't believe as a county we are planning to do that, but I will let Dr. Wooten address that issue of outdoor TVs.
Okay, thank you. But you do think you may step up enforcement, that you're going to talk to others like ABC and the mayor before you make that decision, or?
Hi, this is Dr. Wooten, and thank you for that question. Yes, we will step up enforcement. We do not want people gathering at restaurants, aside from going there to pick up food or to have food outdoors. We are encouraging all individuals, if they're going to watch the Super Bowl, do it in the safety of their homes, with household members only and no others, because that basically constitutes a large gathering. So the situation that Los Angeles has implemented makes perfect sense. We have not issued such guidance, but we will consider it.
Thank you. Next question.
Brandon Lewis at CBS 8. Please state your question.
All right, thank you for taking my question. I actually have two. First, can you give us an update on the MyTurn app and how the MyTurn website is going? I'm still seeing some appointments from Sharp and Scripps, like the South Bay Center, on their own servers. And second, how many vaccines would you estimate have been taken back from entities that didn't have a plan, and does that affect future allocations until they can present a new distribution plan?
Yeah, thank you. On MyTurn, it's going okay. I think that the site is improving. We got in early as a pilot, which meant the rest of the state doesn't have the accessibility of utilizing it. They've made a number of updates. They've made a number of improvements. We continue to work with them on a number of things. And I know that our 2 superstations are working on migrating over. We hope to have that moving by next week. Again, every appointment is being filled, and so we want to make it as convenient as possible. And we know it's frustrating. I think the largest frustration, Brandon, is just there's no appointments available. And that drives a lot of the frustration, which is a supply chain issue. But every appointment has been filled. So, we hope hopefully sometime next week to have all those integrated into one. And as we bring on new sites, we are bringing them into the MyTurn suite of offering of locations. So we think that's encouraging. The partnership with local other partners that may send us some back isn't going to affect their allocation at all. And it isn't a significantly large number. We're talking in the single-digit thousands of vaccines that come over. And I want to commend the overwhelming majority of our partners. Everyone's trying to get vaccines out as quickly as possible. Our health systems are doing a really good job with what they have, administering them to their folks. They're doing an incredible job partnering with us on so many of our pods that are out there. And everyone is facing the same crushing demand for vaccines. And you know, in a way that's encouraging. You know, there was concern, will people want the vaccine? I think it's clear San Diegans want the vaccine. We just don't have enough. And so, you know, by and large, I think we're progressing through this as well we can, given all of the unknowns and all of the very difficult nature of COVID in general.
Thank you.
Matt Hoffman at KPBS, please state your question.
I know you guys touched on Operation Collaboration, which is led by CAL FIRE with firefighters getting vaccines earlier. They've done over 7,000 vaccines. Where do you see that program fitting into the overall vaccine strategy? And I know you talked about some supply questions, but is there hope that you guys can expand that, whether it be at the long-term care facilities or going to places like the Julian Library today?
Well, our hope is, one, we want to get through all the long-term care facilities. Those represent our most vulnerable seniors. And so we want to do that. And again, Matt, that's a mix of Operation Collaboration, what the City of San Diego is getting going with their fire folks in the metro area, and what the pharmacies are also doing. So it is a joint effort again. So we want to knock out all the long-term care facilities, get those folks vaccinated and safe, and then look for opportunities where we can redeploy that workforce to make sure that we are meeting the need. And as we move into some of the additional tiers, you know, there will be even greater need for locations and capacity at locations, and as the supply chain increases, we will need that workforce. So we think that program is going well, and it is much more work when you're doing smaller numbers of vaccines and you're having to move locations like you do with a long-term care facility. But we appreciate tremendously everyone who's been a part of Operation Collaboration. We appreciate the pharmacies and what they're doing. And so we think it's heading in the right direction. And once we get through those long-term care facilities, we can just roll those efforts into our broader vaccine strategy.
And speaking of like some of these rural places, like areas like Valley Center, do you guys plan to put some more like semi-permanent vaccination centers out there, or are you just kind of hoping that some of these mobile arms will be able to reach those places?
Well, we're going to assess based on the need. If there's an area in some of the very low dense population areas, it does not make sense to build out the infrastructure for an ongoing vaccination site, and so that's where we can do that. But again, as we move through, we're going to constantly evaluate what we are doing based on demand, based on availability, based on workforce, and do everything we can to make sure that we get as many people vaccinated as quickly as we can. And in particular, reaching those hard-to-reach communities and communities that may not have the normal access some other folks may have.
And one other quick question. I know we're seeing a lot of pharmacies saying they're going to start offering it. For people, like, is there any difference whether they get it at like a CVS or whether they get it at a county site?
Same vaccine. It's either Moderna or Pfizer.
Thank you.
Yep.
Jonathan Wozen at the San Diego Union Tribune, please state your question.
Yeah, a couple of vaccine-related questions. The first, kind of circling back to Brandon's question earlier, Supervisor Fletcher, I think you mentioned that the county does have the ability to take doses back if a provider doesn't have a solid plan. It just wasn't clear to me. Has the county done that or not done that? We heard something from the governor earlier today about reallocating doses from CVS based on, I guess, them not administering those doses quickly enough. So, question about allocation. And then equity, which I know you touched on earlier in the presser. Just be curious to know, like, how would you rate the job that the county is doing in terms of equitably administering this vaccine throughout the region? Is it, to some degree, do you feel like your hands are tied by the system that we have in place for who can get shots when? It's a little hard for me to assess because on the dashboard, about 20% of the kind of pie chart of the racial or ethnic breakdown consists of people with kind of unknown race. I don't know if you have any clarity on why it's such a big fraction that's not accounted for. And then if there's anything else that you can clarify in terms of what the county's partner organizations, I think United Women of East Africa, the Chicano Federation were mentioned, precisely what they'll be doing to help going forward vaccine-wise.
Yeah, thank you for that. On the first one, we have had a number of healthcare partners that have been willing to send their dosages back, and they weren't in a position to use them, or they weren't going to use them as quickly as we could, and so we appreciate that. And I'll have Dr. Wooten touch on her efforts with healthcare providers. She's been very clear. The expectation is you have a plan, and you have a plan to get them in arms quickly. And if you don't, you could face recall of those, and it certainly could affect the additional dosages that might be directed your way. But again, we want to do it collaborative, and we want to work with folks, and we've generally found very willing partners, and we do appreciate that effort. The second piece, and I'll have Dr. Wooten address that, and then I'll have Supervisor Vargas walk through some of the things we're doing. The equity piece is vitally important, and we did that around testing, and we certainly have driven to do that. The physical location of all of the sites was placed with equity in mind. All of the locations that you see on the map today for sites that are open today are in the overlay of the Health Equity Index from the state of California and the case rates based on zip codes. And so we have placed them in the right communities. Now the challenge is getting the folks from those communities to be able to get in to those appointments. And we have been hamstrung a little bit, and I think this is an important point, which is that the demographics of the county as a whole is not the same as the demographics of who we're vaccinating now. The demographics of healthcare workers and the demographics of seniors are different than the demographics of the county as a whole. And I think what you see reflected right now is vaccination administration that more closely mirrors the demographics of healthcare workers and seniors. And as we move into other populations, we think that those numbers will start right-sizing. But we have been working on a number of programs that are designed to use our community healthcare workers, our promotoras, and designed to help ensure access to available appointments for communities that have been most impacted by COVID. And so we are going to get those programs up and running, and we're going to continue to launch them. We're also increasing the staffing at 211 for seniors who may not have access to a computer. I've been really touched at the kids taking care of parents and grandparents, and neighbors taking care of neighbors, and churches taking care of their members, nonprofits helping those they serve, people really coming together to help seniors navigate a website. My wife's dad lives with us. He's 77. He has access to a computer, but there's probably no website we could ever design that he would be able to easily move through. And so we know that a lot of seniors need help, and so we're encouraged by people stepping up, and we're certainly going to step up and do more as well. But let me have Dr. Wooten address the first issue around the relationship with providers and vaccines, and then we'll have Supervisor Vargas address the importance of equity and some of the new things we're doing.
Thank you, Chair Fletcher. On the Thursday, January 22nd, the state, actually the 21st, the state issued a guidance basically stating that providers that did not use at least 65% of their dose of vaccines that they already had, and if they did not have a plan or mitigation plan to use them over the next 3 to 4 days, then those vaccines could be taken away and reallocated. And there's been a small number of providers for which that particular situation has occurred, and as they need more vaccines, we will provide those. Some providers were holding on for second doses, but the state clearly advised jurisdictions that they wanted all doses to go into arms, first dose, even though they had doses for second dose, to get all of those doses that they had into the arms for first shots. So that's what we have been doing. We are looking at data glitches that could be occurring. We're looking at all of the situations. We are directly calling each provider to find out what their current status is so that we can better get a handle on decreasing that delta that you saw in the dashboard shown earlier. Thank you.
So the question regarding our community partners and the partnerships with the county, these infrastructure and these partnerships got created actually when COVID hit, and in trying to make sure that we were providing testing locations in our neighborhoods to make sure that people had access to COVID testing. One of the reasons why these community partners coalitions were created was to really ensure that the information that was getting out to our communities was really based on cultural competence, making sure that it understood the different communities as well, and that we were making sure that the messages were really targeting our communities in need. What's important to emphasize is that that same group has now transitioned into providing feedback around vaccines, and so we've heard loud and clear. One of the Promotora program or community health worker program that has been created is as a result of what we have heard, which is the intake piece of the application process that has really been hard for many of our community members. So they're helping with that. The messages in language have also been very important, and then reaching out to our different faith-based groups, et cetera, et cetera. So the role of these organizations that have partnered with us and who have been, resources have been allocated to them with this partnership in mind is really as a result of taking the work that we've created to sort of the next level. And I think that, we've been here, this new board has been here 5 weeks, and health equity was one of our first items that we voted on as a board, and it's a result of our commitment to ensuring that our communities have access that they need to make sure that everybody is vaccinated as we move forward. Thank you.
I believe we have one final call-in question.
Paul Sisson at the San Diego Union Tribune. Please state your question.
Thank you. I had a question about second doses and kind of the, I guess you'd say, logistics of second doses. As Dr. Wooten just said, the priority has been to get doses into arms as quickly as possible, and that has meant not reserving a supply for second doses when they come due. You all vaccinated hundreds of thousands of people last month. And so it's the case then that there's going to be a lot of second doses required to be given in February. And so I wonder if as new doses, we're in this supply constrained situation right now where you don't know how many doses you're going to get on a given week or a given day. So in that kind of supply constrained situation, how are you going to make sure that people get their second doses on schedule? Some guidance from the CDC recently that said, well, actually, you can wait up to 6 weeks after the first dose to give the second. So I wonder if you're going to follow that advice or the original time frame, which was closer, I think, to maybe around 3 weeks after the first dose. And so I wonder, as new doses come in this month, are we going to see a situation where you're not able to make any first dose appointments anymore because so many people are going to need second doses?
Yeah, and I'll let Dr. Wooten weigh in on this as well. But right now, Paul, the basic intent is that we'll honor second dose appointments first, and then with what we have left over, we will make first dose appointments. We don't want to cancel appointments, and we think that that's important, again, for the frustration, the confusion, and just the efficiency of what we're doing. And so right now, the general approach is that we honor all second dose appointments, and then based on the supply, we make those first dose appointments available. That's the general approach we're taking now, and I'll let Dr. Wooten add anything to that.
Thanks, Paul, for the opportunity to clarify this important issue. Chair Fletcher is absolutely correct. If an appointment for second dose has already been made, we will honor those appointments. If no appointments have been made and we have vaccines, first dose, second dose it's the same vaccine. So again, the federal and the state's guidance is to get as many shots into arms as possible. And CDC's new guidance regarding when the second dose can be administered is that you can wait at least 6 weeks after either the 21-day or the 28-day second dose date. Now, that's for the two vaccines that are currently out there that we are utilizing. Keep in mind, I think most likely at the end of this week, we will have the Johnson & Johnson vaccine that will be reviewed by the FDA and the CDC. And then there are two other vaccines that will be coming down the pike, AstraZeneca and Norvax. So there's more vaccine coming, but again, we have to be patient. And even with the vaccines that are currently available, the federal government has increased about 20% production so that they can get more vaccines out into the community. Thank you.
So, Doctor, a follow-up on that answer. Thank you so much. In terms of the county's posture in scheduling second doses, is the county going to, A, be going on the 21 to 28 day kind of time frame for landing those second doses, or is the county B going to be going with the let's run it all the way out to 6 weeks?
It could be a combination of both, Paul. It depends upon the supply of vaccine. That is any question pretty much everybody's asked today. The rate limiting step is supply of vaccine. Thank you.
All right, we'll go to our text-in questions.
This one is from Mario Sevilla with ABC 10 News. What is the county doing to ensure homebound seniors and other eligible residents with limited mobility due to disabilities receive their vaccinations? Where is this group in the distribution phases, and who will be administering these vaccinations?
Yeah, thank you, Mario. That's a really important population and community that is important to get vaccinated while we're doing seniors. It's also logistically more challenging and a little bit harder. Our folks that are out that are doing long-term care facilities are also involved in the process of vaccinating seniors who are part of the in-home supportive services program. And then for homebound seniors who are not a part of in-home supportive services, they have two options. One is contacting their healthcare provider where they normally get their health care for how they get there. And then we are going to begin on Monday taking kind of appointments for homebound seniors only through the 211 system. And so they'll be able to call. But again, we ask people's patience. They're getting flooded with calls. There are limited of dosages. There's limited vaccines available. And so we do have plans in place. But, we encourage individuals in that situation, however they normally get their health care, if they can get it via that mechanism, do. If not, then they can put in a call to 211 and say that they are a homebound senior who can't get out, and we will get to them as quick as we can. But again, we ask for folks' patience here. It's very challenging. It's a level of challenge to set up a major station doing lots of people, but there's a fixed infrastructure element of administering vaccines that is still present, even if you're going to a home to do one vaccine. So we're trying to get through long-term care facilities, in-home supportive services, and then work through homebound seniors as well.
Thank you. This question is from Heather Hope with CBS 8. Are there any plans for San Diego to have a federally run vaccination site like the two in Los Angeles and Oakland, which are in partnership with the Biden administration?
Yeah, we requested weeks ago whatever federal help we could get, workforce, sites, vaccines, anything. I think the challenge for San Diego County with what they're doing in Oakland and LA is we have the opposite problem that other areas have. Other counties have a problem of they don't have the capacity or infrastructure to get vaccines in arms. That's not our problem here. We've built out far more infrastructure, workforce, and capacity to give vaccines than we have vaccines available. And so I guess technically we would be eligible for that, but I don't see the federal government placing one of those sites here because, again, we're in a unique situation where we have much more built out and ready to go capacity to administer vaccines than we have actual vaccines. So I don't see them doing that here just because of the work that we've already done.
Okay, this next question is from Alexander Nguyen with KPBS. The man who was reported today as the region's first flu death this season also contracted coronavirus. How did the county determine that he died of flu?
I'll let Dr. McDonald address that question.
Thank you for that question. Unfortunately, we did announce today the first influenza-associated death, a 65-year-old man who with underlying medical conditions who lived in the eastern region of the county who died of complications associated with influenza. Tested positive for SARS-CoV-2, the virus that causes COVID-19. And so we are actually listing this individual as having both a COVID-associated fatality and an influenza-associated fatality. Actually, it turns out that individuals who have severe influenza often can have co-infections. This season, we've had COVID-19 as a dominating illness in the community, and we reported in our influenza watch that we have 39 cases of individuals who had both influenza and SARS-CoV-2 in the same individuals. That led to 8 persons being hospitalized and, unfortunately, this death. In previous seasons, severe influenza has been associated with bacterial pneumonias, and it would be associated, therefore, with both the bacteria that caused the fatality and influenza that causes the fatality. So it's not inconsistent to say that the death was associated with both because the individual tested positive for both shortly before succumbing to the respiratory illness.
Thank you, Dr. McDonald. We'll go to our next question.
This one is from Abby Alford with CBS 8. She asks, Albertsons says it's sourcing its vaccines from the county weekly. What other pharmacies receive vaccines from the county? And is there a plan to distribute vaccines to more pharmacies? If so, what pharmacies?
Yeah, currently in our distribution network is Albertsons, Vaughn's, Ralph's, and Pure Care Pharmacy. Those are the 3. For a pharmacy to get into that system, they need to be approved by the state. And then once approved by the state, then they would come into to our distribution system and we would supply them. Again, understanding the limitations on supply. So those 3, and as more get approved, they'll get added and we'll move forward with those.
This question is from Mimi Alcala with 10 News. Once the vaccine supply eventually increases, will people be able to choose which vaccine they want to receive?
I don't know. I mean, I suppose people would have a lot of choices at that point with where they wanted to go, and perhaps if they want to go to their provider, you know, we'll certainly make available what we get as quick as we can. So that'll be a great problem to have.
Okay, and this is a series of questions from Claudia Buccio with Univision San Diego, and she's requesting that her questions be answered in Spanish. Number 1. Can you walk us through the process of vaccine allocation from the federal government, the role of the state and county? I'll just do these one at a time.
Can you do just one at a time? Yeah, it'll be easier. Please, oh, well, but they have to do it, okay. Go ahead, all 3.
Number 2, can you explain why there are limited appointments and the impact that vaccine supply has on this? And number 3, how will the Promotora's vaccine outreach program work? How will they reach out to elders, or do elders have to reach out to them?
Thank you very much. La primera pregunta es específicamente. Un moment. Okay. La primera pregunta es específicamente cómo es que se nos dan las vacunas aquí en el condado de San Diego. Es un proceso del gobierno federal, existe una fórmula, el gobierno federal distribuye las vacunas al estado y por medio de dirección de la CDC, esas vacunas se distribuyen en los diferentes condados y es como nosotros recibimos las vacunas. Es importante reconocer que estas vacunas no solamente son las vacunas del condado, porque el condado lo que está haciendo es suplementando que también los proveedores tienen vacunas y que también las diferentes lugares como los CVS y otras farmacias que también los están dando. La segunda pregunta es sobre las citas y por qué hay tan pocas citas. Pues desafortunadamente tiene que ver todo eso con la gran cantidad de vacunas que existan. Entonces, mientras que no haya suficientes vacunas, lo que no queremos hacer es cancelar las citas que puedan hacer nuestras comunidades, porque sabemos que están teniendo una gran dificultad en cuanto a hacer las citas para las vacunas. Entonces, lo que estamos haciendo nosotros es crear una infraestructura para que cuando lleguen las vacunas se puedan distribuir, pero por el momento se están haciendo las citas de 2 o 3 días para poder enfocarnos en la gente que los necesita y que no tengamos que cancelar ninguna vacuna. Y la tercera pregunta es sobre las promotoras. El programa de promotores es un programa que tiene mucho tiempo trabajando el condado en colaboración con las organizaciones que han estado colaborando por mucho tiempo. Entonces, este programa es un programa piloto específicamente en el sur de San Diego, en las ciudades de Chula Vista, National City, San Isidro, etcétera, en las comunidades donde hay más necesidad. El programa es piloto porque estamos viendo qué es lo que necesitan las personas, entonces vamos a ir ya sea a los lugares donde la gente va a recoger su comida, a los centros donde la gente esté definitivamente. Entonces, eso es lo que estamos haciendo en colaboración con las diferentes organizaciones para decidir cuáles son los lugares donde tienen que ir. Es importante enfatizar porque la pregunta era si las personas de tercera edad tienen que buscar a las promotoras. La respuesta es no. Nosotros vamos a encargarnos de avisarles en dónde van a estar las promotoras para que la gente tenga ese acceso. Gracias.
Next question.
This one is from Mike McKinnon with KUSI. This weekend, the country will see fans in the stands at the Super Bowl. What is the county doing to make that a reality at Padre games?
County's working incredibly hard to vaccinate folks, to put in place things to lower the case count so we can get aspects of our life that we really enjoy back quickly.
Okay. This one is from Amber Frias with NBC7. Can we get updated numbers on how many cases and deaths we've seen of the UK variant?
Have Dr. McDonald address that for you.
Thank you for that question. We are going to be putting out a summary every Wednesday from now on the variant cases, so that'll be posted on our website. But as of the end of the day yesterday, there have been 137 confirmed B117 cases, that's otherwise known as the UK variant. Those are confirmed cases and represent about a quarter of all the cases that have been reported in the United States. I checked the CDC website just before coming up here, and there are 541 cases reported throughout the United States. In addition to that, there have been 50 probable cases of the B117 variant. We have not seen the South African or the Brazilian variants here in San Diego, and the number of deaths and hospitalizations from the B117 variants are unchanged. There's no increase in either of those categories.
All right, we have two final texting questions.
Yes, this one is from Adam Rakusin from ABC 10 News. It's for you, Supervisor Fletcher. He says, you spoke with the head of Blue Shield. Can you elaborate more on that conversation and how and what they are doing will impact San Diego County?
Yeah, we had a very productive, kind of lengthy conversation. He reached out. He had been told San Diego County really was a model in terms of moving quickly and building out infrastructure and working with our partners. And he just wanted to walk through on what we've been doing and how we're processing all the various aspects of vaccine distribution. They are still working to come up with the general approach on distribution, but conveyed that they would work with the county and would support the efforts that we put in place to be most effective. And so I'm optimistic that nothing negative will come of that arrangement. But again, the state of California and who they choose to help them in allocation is going to face the same problem, and that they can only allocate dosages to counties that they actually get. So they're hamstrung in many ways by the same supply chain issues. But we have a direct line to be engaged and be involved there, and I think our concerns will certainly be considered, and I think we'll have a productive relationship. Last question.
This one is from Michelle Rodriguez from Telemundo 20 and NBC 7. What has the state said in regards to the county's request for more vaccines to compensate for the citizens and lawful residents that live in Baja or Mexico and that want to get vaccinated here?
Well, it's the same issue we've been dealing with most of these issues. It's a supply issue. I think they recognize and understand we have a larger number of folks who work here than just our population and U.S. citizens who come across for work. But again, the limiting factor is not their desire to send us more vaccines, it's just the availability of them.
And the request was for it to be translated into Spanish.
La pregunta era específicamente cuál es la respuesta del gobierno estatal en cuanto a la gran cantidad de personas que son ciudadanos americanos o residentes legales que viven fuera de San Diego, pero que son ciudadanos americanos o residentes y que quieren tener acceso a la vacuna. Y la respuesta que el presidente del condado recomendó y la información es pues de que mientras que lo que estamos haciendo ahorita es que ocupamos tener más vacunas. Entre más vacunas haya, vamos a poder enfocarnos en que todas las personas que la necesiten la obtengan. Así que es importante enfatizar que ahorita lo que estamos haciendo es crear la infraestructura. Cuando tengamos las vacunas, todas las personas que son residentes o ciudadanos y aquellas personas también que no tengan documentos pueden tener acceso a la vacuna. Gracias.
That concludes our media briefing for today. We'll keep you updated between now and next week on any new developments along with the regular updates that we publicly share. We encourage everyone to stay safe, enjoy the Super Bowl responsibly, and go Brady.